Welcome back to Inside. I am here at Dr. Ron Cohen's office, and we're at your office on DuPont, but you've got another office, too, that you travel to in Churubusco.
Yes, we have a part-time office in Churubusco. That's correct.
So lots of places where people can come visit Dr. Cohen, and today we're going to talk about why you should visit Dr. Cohen, or why we think you should visit Dr. Cohen, because we're going to talk about how you choose an orthodontist. So let's say that either I, on my own, because I can see that my child's teeth are in desperate need, or maybe the dentist has said, you know, I see some teeth coming in weird and you should really go see an orthodontist. What is the first thing I should do when I'm faced with that decision? Okay, I need to find an orthodontist.
Call and make an appointment.
Okay, so we're done. And what is something I should I call more than one?
It's never wrong to get more than one opinion.
Okay.
I will tell you that you will find that there are differences between orthodontists. All orthodontists are not the same. All orthodontists do not do the same thing, and they don't all have the same goals as far as their treatment is concerned. Contrary to popular belief, it's not like buying a refrigerator that and a man refrigerator is in a man refrigerator, if they still make those kind.
I have no idea.
I don't know, do you? But in orthodontics, a lot of it has to do with the goals that you have in your treatment, the underlying philosophy of your treatment, and all the technology and all the other things that you have to offer to get to that end result.
So what should be what would be my first question to a potential orthodontist?
I would think that probably the first question would be what are your goals as far as my child, or for me, is concerned. Obviously, you want to listen to your patient's chief complaints and make sure that you can solve those. But the main thing is that, you know, are you looking for just having my teeth straightened, or are there other interrelationships between my teeth and my jaw joint and my airway and my gum tissues and my bone structure? There are a lot of different ways of treatment planning that take into account small parts of just straightening teeth or larger parts of making the entire head healthy.
What is technology important? Do I need to ask orthodontists about what technology is being used?
Well, I believe it is. I mean, when you go to the hospital, you want the latest of technology that they have to help you heal.
Yes.
And why should orthodontics be any different? There's been so many changes now in orthodontics. We've had some segments on different things like Sure Smile and cone beam CT and those things. The things we've talked about with our TMJ therapy, with TrueDent. There are a number of different new technologies that are available that not only can make our treatment more precise, but that allow us to treatment plan taking into account more information instead of less information.
What if I go into an orthodontist, is obviously how they communicate with me when I'm interviewing them, for lack of a better term, or talking to them about myself or my child's potential care is important, but is the communication you do after you become a patient, how important is that?
Oh, I think it's very important. Our patients are much happier when they know what's going on, when they know what's happening. Not only do we always talk to our patients before and after the appointment, as well as during while they're laying back, but it's hard to carry on a conversation when people's fingers are in your mouth. Exactly.
Yeah.
But we make sure that people know what's going on, what's going to happen next. We have the ability through the technology that we use with all the computerization. We can show them movies. We can email information to them. They have access through our website to get into all their records. They can see their x-rays and their photos. We send email announcements and even email newsletters through our Ortho Sesame, which is a word that
I love that word, Ortho Sesame. I'm convinced you say that to your patients when you sit down next to them and they go,
Ah, exactly.
It's a way to get them to open their mouth.
That's right. I feel like a genie sometimes. But being able to communicate well and making sure that your patients fully understand and the parents fully understand what's going on. And it is obviously somewhat of a struggle sometimes, because we know what we're trying to say, and sometimes, even though we try to make it as close to lay terms as possible, sometimes it still can be very confusing. And then it's our job, just as with any orthodontist that you see, or any medical practitioner that you see, it's their job to be able to explain it to you so that you know what's happening, because you can't help unless you know what's going on. And with what we do in orthodontics, we need the cooperation and help of our patient.
Are all orthodontics credentials and schooling the same?
To be a orthodontic specialist, according to the American Dental Association, you have to have gone to a minimum of an 18-month university certified training program. All right.
That's after going to dental school.
That's after going to dental school. All right. You can do orthodontics as a dentist, but you're not an orthodontist unless you've gone through and obtained those credentials. There aren't very many orthodontists who don't continue on and finish up their master's degree, which is what I did. But again, you don't have to have your master's to be an orthodontist. You just have to make sure you've gone through whatever the American Dental Association says is proper for credentialing.
All right. What about staff? If I'm comfortable with the orthodontist medical training, is it important? I mean, they're ultimately making the decision, but is it important to ask about the staff and their credentials?
I think it's real important, number one, to see how long your staff's been with the orthodontist. That usually says a ton as far as how good a person that is to work with, and whether they can get along with them. My staff's been here. I think the shortest one has been 2 years, who's my daughter just graduated from college, but the rest of them anywhere from 18 to 20 years all the way down to 5 to 8 years. It's nice. I think people are very comfortable here. They like what we do. They like the advanced technology that we have. They love interacting with our patients. We have a great patient group, and so I have a hard time getting rid of people.
These are all good questions that someone can ask if they are in need of orthodontic evaluation and deciding where they need to go. All questions that you can come in and ask here at Dr. Ron Cohen's office. Give them a call today or check them out online, drronsmiles.com. We'll be right back on Insight.